The pleura is a serous membrane which is lined by mesothelium. The pink color portion which you can see in this diagram is pleura. There are two pleural sacs, one on the either side of mediastinum. It has an outer layer, the parietal pleura, and an inner layer, the visceral pleura or pulmonary pleura. The two layers are continuous with each other, the hilum of the lungs, and enclosed between them a potential space, the pleural cavity. Mediastinum is the space between two lungs in the thoracic cavity. The blue color layer which you can see in this diagram, that is outer layer, the parietal pleura. The green color layer which you can see in this diagram, that is inner visceral pleura. The space between parietal pleura and visceral pleura is called as pleural cavity. Visceral pleura nerve supply is sympathetic nerve and parasympathetic form of vagus nerve. It is insensitive to pain, lymph drainage, tracheobronchial lymph nodes. Parietal pleura nerve supply is thoracic nerve and phrenic nerve. It is sensitive to pain, lymph drainage, intercostal lymph nodes. Parietal pleura. The parietal pleura is thicker than pulmonary pleura or visceral pleura. The parietal pleura is subdivided into four parts. The costal pleura lines in the thoracic wall and it is loosely attached with the endothoracic fascia. The purple color which you can see in this diagram is costal pleura. The mediastinal pleura lines the corresponding surface of the mediastinum. It is continuous with the pulmonary pleura around the hilum. The red color which you can see in this diagram is mediastinal pleura. The cervical pleura extends into the neck nearly 5 cm above the first costal cartilage and 2.5 cm above the clavicle. It is covered by suprapleural membrane. Green color portion you can see in this diagram is cervical pleura. Diaphragmatic pleura lines the superior aspect of diaphragm. It is continuous with mediastinal pleura medially and costal pleura laterally. Diaphragmatic pleura, as you can see in this diagram, it is continuous with the mediastinal pleura medially and laterally it is continuous with the costal pleura. Pulmonary ligament. The parietal pleura surrounding the root of the lungs extend downwards beyond the root as a fold called pulmonary ligament. The fold contains a thin layer of loose alveolar tissue with a few lymphatics. It provides a dead space into which pulmonary veins can expand during increased venous return as in exercise. These are the pulmonary ligament of left and right lung. Recesses of pleura. There are two recesses of parietal pleura which act as a reserve space for the lung to expand during deep inspiration. These are two recesses of pleura as you can see in this diagram. The costo-mediastinal recesses lies anteriorly behind the sternum and the costal cartilages. This recesses is filled during quiet breathing. These are the costo-medial recesses. The costo-diaphragmatic recesses lies inferiorly between the costal and diaphragmatic pleura. This is the costo-diaphragmatic recesses. Clinical anatomy. Aspiration of any fluid means to remove out any fluid from the pleural cavity is called as paracentesis thoracis. It is usually done in the 8th intercostal space in the mid-axillary line. The needle is passed through the lower part of the space to avoid injury to the principal neurovascular bundles such as veins, arteries and nerves. Pleurisy. This is inflammation of the pleura. There are two types of pleura, wet pleura and dry pleura. Pneumothorax. Pneumo means air, presence of air in the pleural cavity. Hemothorax. Hemo means blood, presence of blood in the pleural cavity. Hydropneumothorax means presence of both fluid and air in the pleural cavity.